How do we work together to make things better? It's no surprise that after all the recent challenges we've faced, the National Health Service, like many other services, has seen skyrocketing demand. The need for high-quality services has never been greater than it is right now. To improve the overall level of healthcare services we can provide, policymakers and governments have now come to realise that the public sector can do more when collaborating with other sectors and specifically with third sector organisations. But to do that, we first need to understand just how the public sector can collaborate with third sector organisations and just how such partnerships may become sustainable over time. This is the core objective of the research programme led by Dr. Lei Liu and Dr. Angela Aristidou. We are carrying out research in places like Cambridgeshire and Peterborough, collaborating with our research partners CPFT, the Cambridgeshire and Peterborough NHS Foundation Trust, and consortia of third sector organisations such as Full Scope. The partnership was put in place with Dr. Ben Underwood, who was at the time Clinical Director with CPFT. He saw the value of this research collaboration and volunteered to be a research partner from as early as when the grant was first being drafted. This is the research grant funded by UK Research Innovation that supports our research programme. The impact of our research programme will be far-reaching. It will help improve patient outcomes and also provide invaluable data and guidance for leaders and policymakers, which could have a lasting impact on how healthcare is provided for decades to come. But that's not all. Researching this topic is important to all the people who actually work in our partnering organisations within the UK National Health Service and those within the third sector. We may help inform them on how to best work in this newly integrated healthcare system. Since nothing in today's hyper-connected world happens in a vacuum, thanks to Dr. Liu's research expertise, we are able to take a novel approach to examine how employees' social context affects these type of cross-sector collaborations by incorporating a social network perspective into our research. All of this promises to open up new directions and possibilities for future research on cross-sector collaborations. Why and how aren't something to be afraid of. We want to find out just how sustainable are partnership models like this. And we will find the answer by using multiple methods to consider all the factors that come into play, particularly in an ecosystem as fundamental to our society as healthcare. Our partners in the public and third sector organisations have helped us co-design our study, and we are already hard at work studying these factors through a combination of documentary analysis, interviews and longitudinal quantitative survey studies over the next 2 years. So stay tuned for our findings, and together we can finally answer the question, how do we work together to make things better?